Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist. Today I wanted to make a quick video chatting about professional development and professional goal setting. So maybe not the sexiest topic, but I do think it is really important in order to grow and develop as a clinician, to learn more, to develop your skills, to provide the best care for your patients, and also to grow and advance in your career. It's a really important thing. So let's get into that. So why is goal setting important? It can be an immensely powerful tool in professional growth, in advancing your career. And there are definitely times when we tend to kind of get really comfy, deep into our comfort zone, and we're maybe not moving forward in the way that we want to be. And not to say that being in your comfort zone is not okay, because it totally is. Everyone has times in their life where they need to just kind of be where you are and not be focused on progressing or moving forward. Sometimes we just need to be where we're at, and that is totally okay. But if you're starting to feel like a little bit stagnant, or things are starting to feel a little bit stale, or you're kind of getting this sense of like, okay, here's what I'm doing, X, Y, and Z, but I'm feeling just like kind of ready to move forward. Setting professional goals for yourself can be a really helpful way to make sure that you're moving in the direction that you want to, and kind of get you out of that stagnant or stale place that maybe you've been sitting in for a little while. We need to challenge ourselves to change. So I think that that's something we all aim to do, or we all should aim to do in some form at different times in our lives. So I think that can be a really just helpful tool in moving the way that you want to. So how do we start to set these professional goals or create these professional goals for ourselves? So I think it's really helpful if you carve out a few minutes of your time where nobody's going to be bothering you, you don't have distractions. Set the mood a little bit, light a candle, get some nice background music going if that helps you, and find some time where you can sit down with your computer or your tablet or just good old pen and paper, and you can jot some ideas down. Take some time to just self-reflect, go within, try and figure out what things you want to accomplish, or what goals you have for yourself, or things that you would like to do. And just sit with yourself and think about what you want professionally. Do you want to become a certified hand therapist? Do you want to sit for the certified hand therapy exam? Do you want to start your own practice? Are you looking to get specialty certifications to provide a specific type of patient care? Are you happy in the job that you're currently in, or are you feeling like you're ready to change things up and move into a different job? Do you want to take on a new or a different role, becoming either a supervisor or a manager, or maybe you want to move a little bit away from patient care and you want to move into research or something different? Do you want to speak or present at a hand therapy conference, or speak for a group of hand therapy clinicians? Do you have a diagnosis or a specific surgical case that you feel you're just kind of weak in that area and you want to get better at treating those cases? There are so many different possibilities and so many different options, just a few kind of ideas to get you started, get the ball rolling. The point is, you want to figure out what you want first. That should be, just kind of sky's the limit, dream big. Get all the ideas out, get them out there. And it's a really nice exercise to be able to figure out what you might want. Once you've selected a few or one long-term goals, you want to start figuring out the how of the way you're going to get there, right? So you want to break it down, make it smaller, break it into small incremental pieces, bite-sized pieces, if you will, so that you can kind of get the task done or figure out what is needed to accomplish your goal. So if you are, just for example, if you're wanting to take the hand therapy exam, the certification exam, you want to break that down into a few different steps. So maybe you want to take a look at the HTCC website and figure out kind of what requirements do I need minimally before I sit for this exam, and how do I apply for that? You would want to figure out what the dates are for the upcoming exams, maybe that, a year in advance or 6 months in advance. You would want to make a goal to gather your study materials, figure out what things you're going to use, resources, classes, books, practice exams, all of that kind of stuff. Start collecting those items. And maybe another goal would be creating a weekly study schedule for yourself to follow, and so on, right? Like, this can be broken up into many, many different small goals so that it doesn't feel so daunting and so overwhelming to start working on this goal. And then you can kind of check these little items off as you're achieving them, and you can actually feel like you're moving forward and track your progress. And I would also say, when you're setting goals for yourself, they should be similar to when you set goals for your patients. They should be specific, they should be measurable, something that you can, objectively measure if you've succeeded or not. They should be attainable, something that's possible. They should be relevant or important to you, and they should be time specific. You want to have kind of a general timeline of when you want to achieve the goal. And then the fun part comes. You get to figure out what you do with these goals. Do you want to display them? Do you want to hang them in your bathroom so that every day when you wake up, it's the first thing you see and you're inspired to achieve? Do you want to keep them kind of stored on your phone or in a notebook that every few months you kind of look back at it? I think everybody is going to have a different preference with that. For me, I like to use the Good Notes app on my iPad. I actually have a specific folder and then kind of notebooks for different goals that I have going at once, because it helps me to get all my ideas out and figure out exactly what I want to achieve. And then it's kind of fun for me to look through every couple of months or a few times a year and just see, okay, I kind of achieved this goal, or maybe this goal is something that no longer is important to me, or maybe I need to change it a little bit or adjust it. So I think that is something that's been particularly helpful for me. And everybody is a little bit different. Some people are going to prefer to make goals once a year. Some people are going to prefer to make goals, weekly or monthly or quarterly. So you just have to figure out kind of what works best for you. And that way you can kind of keep moving forward and keep progressing in the way that you want to and advance your career and your professional development. All right, so again, thank you guys for sitting with me through all of that. I know that it may be something that seems kind of common sense, but I think we all need these little sparks of inspiration and kind of reminders to touch base with yourself, figure out what's important to you, and then kind of push that into a path forward. So thank you all so much for watching today. I hope you enjoyed the video. If you did, go ahead and give it a thumbs up, and you can always subscribe, and I will see you next time. Thank you.